And I'm Tiffany.
And we're going to talk about strokes. A stroke is a cerebrovascular accident that occurs when blood flow to part of the brain stops. If blood flow is stopped for longer than a couple of seconds, the brain cannot give blood or oxygen and can undergo permanent damage. There are two main types of strokes. An ischemic stroke occurs when a blood vessel that supplies blood to the brain is blocked by a blood clot. A hemorrhagic stroke occurs when a blood vessel in part of the brain becomes weak and bursts open, causing bad blood to leak into the brain.
Stroke symptoms include headaches, especially ones that start suddenly and are severe, and occur when you are laying flat, they wake you up from your sleep, and they get worse as you change positions throughout the night. Also, a change in your body that can affect your touch. This is touch in the ability to feel different temperatures, the ability to feel pain, or the ability to feel pressure. Numbness and tingling also occur. This should be on one side of the body and extremely noticeable. You also will have changes in eyesight, and this can...
Development of the disease is caused by health factors such as diabetes and high cholesterol. It can also be genetic, so family history can affect the chances of stroke, and it can also be caused by increasing age or race.
Yep.
Stroke can affect any area of the brain, depending on where.
Go ahead.
Diagnosis of stroke include multiple tests. Your doctor will check your vision, reflexes, and understanding of speaking. Your doctor will also listen for abnormal sounds in your carotid arteries. These arteries are found in your neck. This sound is called a bruit. A bruit is a result of abnormal blood flow. A CT scan and an MRI scan of the brain will also be done. A carotid duplex, which is an ultrasound that shows if carotid arteries in your neck have narrowed. An angiogram of the head, which shows which blood vessels are blocked and bleeding.
Stroke treatment includes clot-busting drugs that are designed to dissolve the clot that causes the stroke. Blood thinners that are used to prevent blood clots can also be used as treatment. Special procedures used to prevent future strokes include physical therapy, occupational therapy, and speech therapy to regain functionality.
Prognosis. Problems moving, thinking, and speaking are all usually treatable in therapy sessions. People who have strokes will continue to improve on these months or years after their stroke. Over half of the people who have strokes are able to function completely on their own. Famous people who have had strokes include Dick Clark and Luther Vandross. There are a number of stroke organizations, and these include the World Stroke Organization, the National Stroke Association, and the American Stroke Association.
But putting all that together is all about your mentality. Because you can look at yourself as a victim, or you can look at yourself as someone special. And I've always looked at myself as not a victim, but someone special. So, I mean, it's an everyday life, you know. After you get over the part that you had the stroke after being paralyzed, then you have to go on with your life and live your life as normal people live their lives.
Go ahead.
Once again, I'm Kaylin.
And I'm Tiffany.
And you just learned about strokes.